Hi, everybody. So, as promised, today I'm going to talk about cough as it's related to more cold and flu symptoms, the kind that's very prevalent this time of year in the winter. We're definitely in the middle of cold and flu season. The last video I talked about allergies and promised that today I would shift gears to the kind of cough that you would have during a cold. But it was a little difficult to organize this because it's like two different things coming together. It's really more about if it's a drip cough from the nose or if it's something coming from the lower respiratory tract. And the treatment is the same, whether if you have a drip cough, a runny nose causing a drip cough, the treatment is the same whether that drip is from allergies or a cold virus. A drip is a drip. And so a lot of the remedies that I had talked about last time are going to be the same remedies that you can use if it's a cold virus. The difference is just looking for the different symptoms so that you know whether or not you're dealing with a cold virus or allergies. And the biggest thing, of course, is if there's a fever, then you know it's a cold. If it lasts more than 2 weeks, it's probably allergies. But other than those two details, you're still dealing with runny nose, cough, congestion. And so another thing that's different is how to know when you're dealing with a cold virus. Don't forget you can boost the immune system, and that can help. It's not going to help if it's allergies, but if you're pretty sure you're dealing with a cold virus, that's when you want to go back to the basics and boost that immune system with things I've talked about. There's another video about boosting the immune system you can review, but just for a quick review, the vitamin D and, of course, the good old bacillococcinum or oscillococcinum, however you want to pronounce it. This is, looks like, oh, it's upside down. And you can get this at the most pharmacies. The Dr. Nenninger's Triple Flu Defense, also a great immune system booster. It's a little harder to find. You may get it at some health food stores or natural remedy stores, or you can get it online. I think it's available on Amazon. So after you've done your best, you know you're dealing with a cold virus, you got a little fever going on, you're a little run down, you're boosting the immune system. Now let's talk about some things that can help with the cough and the runny nose. And again, very similar to what was in the video about allergies, but just for a quick review, you've got Dr. Nenninger's cold and sinus relief. This is a symptom reliever, so this is what you want to take to relieve a runny nose, cough, and congestion. This one is an immune system booster. It may have some symptom relievers in it, but the purpose of these two products is very different. This one is more prevent and try to reduce the duration of a virus, where this one is what you're going to use to relieve the symptoms. This does not have the immune system boosting effects. Other than that, another thing that sounds very simple but's often overlooked is just positional. The drip cough from a runny nose is a very positional cough. And what that means is if you're sitting up, it's better. If you're lying down, it's worse. So you can use position to try to help relieve that. If your child has a bad cold, you're going to find nighttime's the worst. They're laying down. They can't breathe easily. They're coughing a lot. They can't sleep. Sometimes just as simple as propping them up on a pillow or using one of those wedge positioners so that you can get that upright position. That'll redirect the drip from hitting the cough reflex so that it'll just hit a different part of your throat, not make you cough as much, and can give you a little bit of relief. Another thing that's often simple but overlooked is just hydrating, super hydration. Pushing fluids constantly, having your child drink a lot of water, a lot of coconut water, anything just to keep them hydrated, as well as breathing humidified air, the steamy shower, or running a humidifier. So I know those are basics, but sometimes they really do make a difference. So now the biggest thing about talking about cold and flu virus or cold viruses versus allergies is you want to know, well, when should I worry? And, what are those red flags that I'm looking for that tell me maybe this isn't just a runny nose, drip cough, maybe this is something more serious. One of the differences that I like to explain is the timing of the fever. If you have a fever in the first 24 hours and then cold symptoms follow, you're dealing with a virus, and it's usually not a complicated virus. When I worry is when a child's had cold symptoms for a couple of days, maybe a week, and then all of a sudden they have a fever. So, and usually it's a high fever. So if a fever spikes late in a cold virus, then that's more of a red flag than if it's at the beginning of the cold virus. And that's because the fever is spiking because after having those cold symptoms for a week, the immune system's getting a little depressed. Your respiratory tract has been working really hard trying to keep itself clear, and everything just starts to run out of steam. And then those mucus plugs can start getting a little deeper into the lungs. The body does not like that. When that happens, the body tries to kill it by spiking a high fever. Same thing with sinuses or an ear infection, bronchitis. All of these things are things I would typically see towards the end of a cold. Often the parents would say, well, we really thought we were getting better. My child seemed to be getting better. They had a good day. Maybe the fever was down to low grade. Their energy was better. And then the next day, all of a sudden they got worse. They spiked a high fever again, and the cough came back with a vengeance. That gets my attention. That's when the lungs need to be checked by a medical provider, somebody to listen to the lungs to make sure it's not a pneumonia or bronchitis or an ear infection or a sinus infection. And I always say the frequency of a cough is more important than the forcefulness of a cough. You could have the most horrendous sounding, deep, forceful cough, but if it's only 2 or 3 times a day, it's really not a big concern. Usually that's just from that runny nose dripping down the back of your throat, and then it collects and collects, and then finally you just have this huge coughing fit to clear it. But you can have a dry hacking cough and it may not catch much attention. It may not sound that bad, but if it is constant, your child is constantly coughing, cough, 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 cough. You don't go 10 or 15 minutes without a cough. That gets my attention. And that is much more of a sign of deep bronchial inflammation. And that is a big red flag that you need to get your child checked. They might need some prescription medication, or at least just somebody to make sure that you're not dealing with something that's getting worse. So, which it's funny to me because often the cough, if you're in line at the grocery store, that gets the most attention from most people, it won't really bother me that much. But if I'm in line next to a kid that it may be a very kind of quiet, dry, hacking cough, but it's constant, that's the kid that I kind of keep my distance from. So, that's just a simple way to delineate a cough that's worrisome from a cough that is still manageable at home. So now I want to talk about a few different things, different types of coughs that are a little bit harder to manage and a little more worrisome. One of them is called a paroxysmal cough. And this is probably one of the most frustrating situations because it's really just that you've had a cold and a cough for so long, your respiratory tract gets very, very inflamed and irritated. And the reason it's frustrating is because there's not really much else you can do for it. It's not a medical emergency. If your child's developing a pneumonia or bronchitis, that's terrible, but you can go to urgent care or go to their medical provider and you can get medication prescribed that's going to make them feel better. And there's a light at the end of the tunnel. Okay, I'm going to give my child these medications. They're going to feel better. Your child's got asthma or developing a viral bronchiolitis and they're wheezing. You go to get them checked medically and okay, I'm going to do the nebulizer with this albuterol and they're going to get better. What's frustrating about a paroxysmal cough is it's not medically serious, but it's very hard to stop and it can drive everybody crazy. So, usually the pattern is you have a cold, the cough gets really bad, you go to get checked. They're like, oh no, it's a virus. Your lungs are clear. Everything's okay. And then you're sitting there like, yeah, but what do I do to make this cough stop? Because it's driving us all crazy. Unfortunately, even the medical staff would be like, well, there's really not much we can do, just a lot of supportive care. So you bring them home, and now we're going to talk about what that supportive care is. Sometimes it just sounds so simple when I've talked about it. I've had people look at me like I'm crazy. Like, you can't tell me my kid has been coughing for 3 days, 23 hours a day, and you're just going to recommend a popsicle? But believe it or not, sucking on a popsicle, I've seen it with my own eyes. I've seen it stop a paroxysmal cough. Drinking warm herbal tea, maybe with some honey in it. Just anything to just soothe the respiratory tract. and the back of the throat. Because the the key with a paroxysmal cough is you just have to do whatever it takes to stop the cough, give the person a break, and give that cough reflex a chance to kind of cool off and calm down a little bit. Because what causes a paroxysmal cough is the cough reflex in the back of their airway. It just, from being dripped on for days, it just gets so inflamed and irritated. But then the more you cough, the more irritated it gets, and the more irritated it gets, the more you cough. So it becomes a vicious cycle. So you just need to break the cycle. And sometimes it is as simple as sucking on a lollipop or a popsicle or drinking some warm tea. It's definitely worth trying. Now, I use the analogy, it's like a mosquito bite. The more a mosquito bite itches, the more you scratch it. But then the more you scratch it, the more it itches. So it's similar in that regard. Sometimes when all of your natural remedies, your herbal cough syrup, you've tried the tea, you've tried the popsicle, maybe it's bedtime, and you really just know your child just really needs a break. And, I just want to mention a couple mainstream over-the-counter medical options. One of them is giving a dose of Benadryl. Even though Benadryl is an allergy medicine, what it's really doing is drying up the drip, helping them to sleep. And I've seen more times than not, just the Benadryl itself can break the cycle. So giving a dose of Benadryl, even though it may be labeled as an allergy medicine, like I said, it dries up the drip. Whether the drip is from a cold virus or an allergy, it'll dry up the drip. It'll give you some peace. Give the child a rest. Hopefully the rest will be long enough to reset that cough reflex. And then for the last ditch effort, there is a product called Delsum 12. It's in an orange labeled bottle. The generic name is dextromethorphan. Dextromethorphan is the strongest cough suppressant you can give safely to a child, short of codeine. The only thing stronger than dextromethorphan is codeine. And I wouldn't recommend, usually you don't need to do codeine cough syrup for, a child. We don't even need to go into why that's a bad idea. But the reason I mention that is so you appreciate that something that's as simple as being an over-the-counter medication, just because it's over-the-counter doesn't mean it's not very strong and very effective. So if you're at your wit's end and you just need to do whatever it takes and you're beyond your natural home remedies, the Delsum 12 is something worth considering. As always with these medications, be very careful and aware that the dose is based on weight rather than age. And if there's a discrepancy between the age instructions and the weight instructions, always default to the weight, because the weight is the more important measurement. We all know you can have a whole room full of 4-year-olds and they can have vastly different weights. So the weight is the most important part. And then one of the more serious conditions that I want to talk about is croup. Not just because croup is one of the most frustrating cough-related situations, but it's also something that's very common when there's a break in the season. So what that means is when you're just at the tipping point between winter and spring, like we are now, or at the other half of the year when you're tipping from autumn to winter, usually when we have that first cold snap, that's when the croupers start crouping. So croup is a condition where it's a little deeper than that upper respiratory cough reflex that I was talking about. If the drip goes a little deeper and it's hitting the vocal cords, that triggers the vocal cords to become inflamed, irritated, and sometimes go into spasm. So croup is also the kind of thing that you don't usually see at the beginning of a cold. You see it towards the end of a cold. And again, because those vocal cords have been getting dripped on for a week constantly, and they just get inflamed and irritated, just like that mosquito bite analogy. It's just that it's a little deeper in the airway. So it's not quite in the lungs yet. It's in the vocal cords. And that's why as adults, and often when kids have croup, they also have laryngitis. Croup is actually a symptom. It's not a disease the way that strep throat is a diagnosis. Croup is more of a symptom the way that we talk about cough or fever being a symptom. Croup refers to any time that the vocal cords become very inflamed, swollen and irritated, and you have that bark cough. Just like the laryngitis, your voice sounds funny. That's why the cough sounds funny. So it really does sound like a seal barking. So when you hear that bark cough, That's when you know you're dealing with croup. And sometimes it even gets bad enough that if the vocal cords go into spasm, you'll get this bark, bark, ee, bark, bark, ee. And that breathing in, that sucking sound, that's called stridor. And if you're dealing with that, that means the croup is getting really bad. And, you're going to want to intervene urgently, immediately. And if you don't if things don't start getting better in about 15 to 20 minutes, you may have to go to urgent care. But there are a lot of things you can do that often work. And it's definitely worth trying those things at home, because croup always hits in the middle of the night, usually because your child's been laying down and sleeping. And after an hour of dripping, they wake up and they go into a croup spell. Nobody wants to have to rush their kid out to the emergency room in the middle of the night if they don't have to. But of course, if you have to, you have to. But if there's a couple things you can do that might be able to bring down that inflammation and have them breathe more comfortably and more easily, then it's worth trying. The funny thing about croup is it's two opposite things that both work. It's either very cold air or very warm, humid air. And the reason for that is because the cold air will bring down the swelling that's in the airway. So if your child wakes up with a croup spell, you very often, traditionally, you'd hear stories about the parents would wrap the child in a blanket, rush them outside, put them in the car, drive them to the emergency room. And back in the day, before cars had heat or air conditioning, they'd maybe have the window down. They'd find that cold air, the child would breathe easily. And by the time they got to the emergency room, they were already better. And that's because breathing that cold air, either from just going from the house to the car or the car into the emergency room, was enough to help break that croup spasm. So some parents will just open up their freezer door and have their child breathe that cold air from the freezer. So that can certainly help. And then the other side of that is the warm humidity. And that's where we've all heard stories growing up of our grandparents maybe putting us in a bathroom with the shower running to fill the bathroom full of steam. And that works because it lubricates that humid, steamy, warm air, lubricates the vocal cords so that they're not stuck. They can move more easily, and that can relieve the croup as well. And often it can take the edge off just enough that between getting them out of the croup spell with the warm humidity or the cold air, they've calmed down, and you can kind of have them sleep propping up, maybe with a dose of Benadryl that can get you through the night. However, if this intervention doesn't seem to help after about 15 minutes, then that's where the croup might be too severe, and you do end up having to go to the hospital, and they'll probably give the child a steroid, either whether it's prednisone or Decadron. Both of those steroids, the point is to bring down the swelling in the vocal cords. Now, croup is also something that most children will outgrow because it's directly related to the size of the airway. And that's why croup is more common the younger and smaller you are. And then usually by about between 6 to 8 years of age, the child's gotten bigger, they're growing. That means their airway's gotten bigger too. So they no longer have the croup, but they might have laryngitis. And it's funny because I tell adults all the time, I say, well, we get croup too, but we call it laryngitis because our airway is big enough that we don't have the crouping part. But it's all caused by the same cold viruses, caused by the same drip. It just affects us differently. And I've even seen some very petite adults that will still have croup into their adulthood. And I've seen some really big kids who outgrow croup younger. So it really is something that's related to the size of the child, size of the airway, and something you can outgrow. That being said, I'll often say kids that are croupers are going to croup. So once you've noticed that your child is prone to croup, that means they're prone to croup. And what that means is you can have a couple different kids. They're a little bit different sizes. One kid is a little tinier, has a tinier airway, and every time they get a cold, they croup. Another kid might be a little bit bigger, their airway might be bigger, and they might get something else. Maybe they get ear infections instead. Or, it seems like kids often have their little vulnerabilities. Kids that are prone to ear infections or kids that are prone to croup. That's just how it is. But, and then just to touch on one more thing I mentioned briefly earlier, but I really want to make sure that the information doesn't get missed, is if you have a child that has, wheezing, and, that means it's deep in the lungs, the bronchioles are inflamed. When they're inflamed, they swell. And that's when you can sometimes hear the wheezing, sometimes not. But the one thing you won't miss is that this child is coughing constantly. So if your child is just coughing constantly, nothing seems to help, then they may be having an asthma attack or reactive airway, which is a term we use that is the same of an asthma attack, but we use that term when it's somebody who doesn't have asthma as a diagnosis. So it's okay, you're not somebody with a history of asthma, but you just got a really bad cold virus, and now it's gone down to the bronchioles. You've got the bronchioles are tight, you're wheezing, it's a reactive airway situation. But obviously, there's really nothing that can be done outside of mainstream medicine for that. And your child needs to be treated, pretty urgently. Like, this isn't something you want to wait on. If your child's wheezing, or if you think they may be having some wheezing condition like reactive airway or asthma, they need the medications that the medical provider will give. They need the steroids, they need the bronchodilators, and that's just the way it is. Unfortunately, as moms, we can't treat everything on our own. Sometimes we need to get a little bit of help. Anyway, thanks for listening. And if you have any topics or any ideas, things that you'd like me to cover, you can definitely send me a message or email and, let me know. And I'd love to get some feedback on some different topics. So I will see you all next week. And hopefully I'll see some of you this weekend in New York at the in-person lecture. And have a great week. Remember, it's a great day outside, so, get out there and enjoy it.